Get your eyebrow pierced. From choosing a professional to aftercare. Eyebrow piercings are relatively common. They may be anywhere along the eyebrow from directly above the eye to the edge of the eyebrow. As with any body modification, you should do your research before you decide where to have this eyebrow piercing procedure done. Here are some answers to the most common questions, as well as how to choose a professional, and how to take care of your piercing and eyebrow rings after the procedure is done. General info for how to get an eyebrow piercing. If performed by a professional, nearly all piercings are safe. Yes, it is going to hurt. Compared to a tattoo, the pain of a piercing is much shorter, less than a minute to be exact. Don't bother with trying to find some numbing cream, in my opinion. They are a waste of money. The pain is only going to last a few seconds, so it is not needed. Brow piercings can be irritated by eyebrow hairs, so plucking closest to the entry points of the piercing jewelry can be very helpful. Don't use waxes or any other hair removers while you're healing. Tipping your piercing artists is always welcomed, though there are no formal rules on the subject. As long as you keep your piercing clean, more on that later, then you should have no problems continuing your regular exercise routine. If you are currently sick, do not get a piercing until you're fully recovered. You're going to need your strength and your white blood cells to heal your piercing, something your body won't be able to do if it's already doing battle against a virus or bacteria. Choosing your professional. Do not do your piercing at home. Simply put, you are putting your life in danger by doing so. Do not get pierced with a gun, squeeze piercer, or anything other than an approved, sterile body piercing needle. Take your time choosing a professional. It is very exciting to get a piercing, but you want to make sure you are spending your hard-earned money on something that you can be confident is safe. Visiting several studios will give you an idea of local prices, as well as common safety procedures. Again, this is your money and your safety, so make sure to be picky. If you only know of one piercing studio in the area, be willing to travel to check out others. Just like tattoo artists, piercers usually have portfolios of their work. Take the time to look at the work they have done in the past. Piercings should be well placed, even, and healthy. If you have friends that have piercings, they can be the best source of info on the topic of studios. Get their advice on where they went and what to look for. You can't beat first-hand advice. Even if you see someone on the street with a good piercing, Take the time to talk to him about where he got it done. Most folks love to talk about their body art. Aftercare. Your piercer will offer the best advice on taking care of your new piercing. These are just basic tips from experienced clients. When getting it done, be sure to follow the piercer's directions for care so you don't get an infection. Healing takes, on average, 6 to 8 weeks. That time can be lengthened if the area happens to get infected. Most infections are caused by simply touching it too much. Only touch the piercing while you are cleaning it. The easiest and most basic way to prevent infection is by cleaning the piercing daily. Most do it in the shower. Make some salt water up by dissolving sea or table salt in warm water. Soak a clean cotton ball in the salt water and apply it to the area for 2 to 3 minutes or until any crusting is dissolved. It's important to remove all the crusting because it can concrete on the eyebrow jewelry and tear the inside of the wound, causing pain and inflammation. Rinse with fresh water and move the jewelry very gently to ensure that there is no crusting remaining. Dry the piercing after your shower with a clean tissue or piece of toilet paper. Towels harbor bacteria. Be careful to pat it dry. Don't rub it as this can aggravate the wound. Use lavender oil as it promotes healing and lubricates the wound, reducing tenderness. Apply a small amount with a cotton ball after cleaning, being careful not to get it into your eye, then move the jewelry gently so it gets into the wound. Remove any excess with a tissue as leaving it on can cause the skin to become irritated. Try to sleep on the side opposite the piercing. This reduces movement of the ring. Keep your bedding clean, especially your pillowcases, to reduce the chance of infections. If you think that your piercing might be infected, do not remove the jewelry. Call your piercing studio right away. Tell them your symptoms over the phone and they will be able to advise you further. Do not stop the aftercare regimen until the full amount of time recommended by your piercer has passed. Related videos: How to pierce your body, Part 2 halves.